So how do you know if you have pelvic floor dysfunction? Now, after pregnancy and birth, put a lot of pressure on your pelvic floor, and vaginal birth will obviously put a lot of pressure on your pelvic floor. It will get stretched, it may have been torn, it may have been cut, and you may have stitches. There's a very, very high chance of pelvic floor dysfunction, of just something going wrong with your pelvic floor after having a baby. And some of them have some really obvious symptoms and some don't. So in this video, I want to talk about some of the really obvious symptoms, then some of the less obvious symptoms, and then what to do if you have no symptoms. So the really obvious symptoms are things like any kind of incontinence. So that may be urinary continence and it may be fecal incontinence. They're very, very obvious if you pee yourself or poo yourself, or if you can't control gases, if they kind of just pop out of you and you don't have any control over it. It may be to do with your pelvic floor and the inability to a weakness in the muscles that close everything up and control things like the escape of gases or fecal matter or urine. So that's a really obvious symptom. If you're experiencing any of these, and I should say there are different types of urinary incontinence. So there's something called stress urinary incontinence, where you pee yourself when you jump or run or sneeze or cough or laugh, maybe anything that puts pressure, increases our intra-abdominal pressure and puts pressure down on the pelvic floor. That's called stress urinary incontinence. There's also incontinence with sex. There's also issue where you go to the toilet and then after you've been to the toilet, a little bit of wee dribbles down your leg. There's incontinence. There's frequent urinary incontinence where you just kind of willy-nilly pee yourself. These issues are obviously really, really obvious, and you need to get them checked. You need to go see a pelvic floor physio who can assess and who can treat your pelvic floor and who can give you prescribed exercises for your pelvic floor. Another really obvious sign may be a really obvious pelvic organ prolapse, where the organs are protruding out of or prolapsing out of the vagina, and that's going to be something that you might feel, you might see, and it's quite an extreme. That's quite an extreme form of it, but it's definitely something that you need to know. You need to treat if you are experiencing that. So, and then some. But they're the really, really, really obvious ones. Let's move on to the kind of less obvious problems. So less obvious problems might be pain. It might be pain in your pelvic floor when you do certain activities, or when you have sex, or when you pee. It may be due to a tight pelvic floor, a pelvic floor that's too tight. It may be to do with the stitches that you had. It may be to do with lots and lots of different things. And that's why it's important to go and see a pelvic floor physio who can assess that and who can treat it. You shouldn't be living with pain in your pelvic floor. So pain can be a little bit, it may be obvious, but it may be kind of a little bit less obvious to you that isn't something that's normal. But it may also be just a general feeling of, like, I don't know, urgency, for example, like you just need to go to the toilet, you're bursting to go to the toilet and you don't feel like you can hold it in, which might not be quite as obvious as like leaking, for example. You might also just have a general feeling of like heaviness in your vagina, and a heaviness in the pelvic floor, a bulging kind of feeling. You might have a tampon sort of sensation, like something just might not feel right. And that may not be really obvious to you that you need to get that treated, but you should go and see a pelvic floor physio if you're having any of those issues, because it could be a really mild prolapse that we can prevent from getting worse. And it may be a really It may be that something's weak or something is not balanced in your pelvic floor. And if we address it, we can improve it and improve your quality of life so that you're not living with pain or with this annoying sensation in your vagina. It may also just be a general feeling of discomfort or a general feeling of weakness. Like lots of women describe, like, I just feel weaker. I don't know how I know that. It just feels like my pelvic floor is weaker. And that is also a legitimate concern, and you should go and get it checked and make sure that you treat any underlying issues involved in that. It might be nothing, but it might be something that can be treated and we can improve it, because it's really annoying walking around every day with just a feeling of weakness or discomfort in your pelvic floor between your legs. It's not easy to just continue on with your life. It's very distracting. It's always there. You shouldn't be living with that. So go and get it checked out. And the final group are people who are like, I don't have any issues with my pelvic floor. Don't have anything, like nothing's wrong. I don't have any incontinence. I don't have any weird feelings. Everything feels the same. So first of all, good for you, because that's awesome. It is awesome to feel that way after giving birth, and it's very, very rare. It may be that there's generally nothing wrong, and it may be that you just don't know what you're feeling, what you should be listening for, what you might be feeling, okay? So even in that scenario, you should go and see a pelvic floor physio. If you have been pregnant and given birth, especially if you've had a vaginal birth, you should go and see a pelvic floor physio just to make sure that everything is fine and to nip anything in the bud if there is anything wrong. I can understand why women don't want to do that if they don't have any issues, but I'm just putting it out there, and my official professional recommendation is to go and get that checked out. So those are the things that, women ask me all the time, like, how do I know if I have any sort of pelvic floor dysfunction? How do I know if my pelvic floor is weak? You don't necessarily, and you need to go and see a professional who can check it out. But in this video, I describe to you the symptoms, the big symptoms, the kind of the really obvious ones, the less obvious ones, and then finally the like what if you don't have any symptoms whatsoever. I think I should do a video on what pelvic organ prolapse is, but I think I'll make that a separate video.